1 year after President Obama's signing of the health care law, the debate rages on. 28 states have challenged the constitutionality of the law. Joining us now, Erica Payne, founder of the Agenda Project. Erica, the simple question here, is the law unconstitutional in your opinion?
You know, I don't think it is. There's disagreement on this. The question is, is a lack of activity engaging in commerce? That's the question, is if people don't buy health insurance, are they engaging in commerce in some way? So that's where the big debate is. My opinion, and the opinion of a lot of legal scholars, is that you can say that inactivity is part of commerce, because when people don't pay for health insurance, somebody else ends up paying for it when they show up at the emergency room. So commerce is taking place whether or not that person is actually paying for the service they're getting or not. So I say the answer is a very clear yes.
Greg?
Erica is actually right in her argument. However, I think that in the end it will be declared unconstitutional. And the principal reason is Congress never before has gone this far to say that we're going to regulate every American's activity simply because they suck air, they breathe, they exist. And it sends you down a very slippery slope. You know, Erica, at what point in time is the federal government going to say, all right, your failure to exercise every day and eat fruits and vegetables and a lot of broccoli is impacting the healthcare system, so now we're going to order you to do that? See, that's the real problem here, isn't it?
Well, I don't think it is. You say that they're challenging people, to join private insurance just because they wake up and breathe, and that's actually not the case. What we've done as a society in the first place is say that you can't deny someone health coverage when they show up at the emergency room. And so what we've done there, if we want to change that premise, which I think most moral people would not want to change, then we've already taken that first step of, we have as a society decided that we're all in the healthcare system. So if you have a car wreck and don't have health insurance, you're going to get treated.
We're not all in the healthcare system. My grandmother, who lived to be 95, was Christian Science, never saw a doctor in her life, never cost anybody any money in the healthcare system. And there are a great many people out there just like that. So, Erica, are you going to force my little old grandmother to go out and purchase a product?
Well, the thing is, so I love that your grandmother lived to be 90. My grandmother lived to be 96, and I think she spent 2 minutes in a doctor's office. So, I think there are a few lucky people who don't have accidents in their life, don't end up, getting hurt, getting cancer, that kind of thing. But the vast majority of people in the country at some point or another do take part in healthcare services. And we had 30 million people before this law was passed, 30 million people who were actually getting services that they weren't paying for. So I think us as society saying you need to take responsibility for your own health care is not that bad.
Is it legal? This is in the courts.
We don't know.
Every court
because
so
Congress,
far that's heard this case has said no.
No, you've got 2 federal judges who said it is constitutional, 2 federal judges who say it is not.
But the state,
it is a legitimate.
AG, but the one that
the
really
biggest
counts,
case.
the big one, and
Right.
every layer every court that case has gone through with the multiple AGs.
Well, I think what's going to happen is this is going to work its way pretty quickly, and maybe on an expedited basis, to the U.S. Supreme Court. They could arguably hear it next fall, because there's already an existing appeal, and we're waiting for an appellate decision. So I think, and the United States Supreme Court, as I read them, are 5-4 on this issue in favor of declaring it unconstitutional. The swing vote is Anthony Kennedy, as he often is. We don't know how he would vote, but I think you've got 4 solid unconstitutional, 4 on the other, and then the swing is Kennedy, and I think he'll side by declaring Congress went too far this time.
And I respect the opinion. I'm glad that your grandmother never used health care. And Erica, to you, I have to say that I respect the fact that anybody can go to an emergency room, and whether or not they have health insurance, they can get treatment at the same time. At what point does personal responsibility come into all of it? I mean, I love donuts, but I don't eat them because I just can't. You know what I'm saying?
Right.
So,
I mean, that's what I actually really like about the health care bill, is that we're asking 30 million people to take responsibility for the fact that they're probably going to end up in the health care system, and they should pay for that if they're able to, instead of relying on the taxpayers to pay for it. So I like that part of it.
Why has the Obama administration granted more than 1,000 waivers so far? Isn't that a pretty good indication, Erica, that this law is not well considered?
10 seconds.
You know what? Laws in Washington right now, I think the fact they've only had 1,000 waivers on things is a great sign, because my
Oh, it's
goodness,
gonna go up.
that place is broken like I've never seen. So
Well,
1,000
pretty soon,
waivers.
You're going to have 50 waivers for 50 states.
Erica, thank you very much.
Okay,
Erica
thank
Payne,
you.
the founder of the Agenda Project. Of course, thanks to Greg Jarrett as well. And I want to hear what your grandmother was eating and not drinking and running and whatever else she was doing. I want stories.
She never drove a car. She never had a job. And you can live to be 95 if you
Without
do
the
those two
stress.
things.